This talk is about neck pain, but also correlates with headaches, with shoulder pain, with upper back pain, even with nerve pain down the arm, even down the legs, through like sciatica. So we want to make sure we're looking at the overall body. How's it affected? So let me adjust this real quick. I like to be uneven. When we talk about neck pain, we talk about problems that come from here, base of the neck, down the shoulders, almost upper back here. It's all correlated. If I was to draw, I'll get the mark in a second. Also, a triangle. We want to make sure we talk about neck pain with our patients. We look for, is it really the neck? Is it the shoulder? Is it the shoulder out here? Or is it the upper back? Okay? We want to talk about when it's neck pain itself here, how does it affect the range of motion? Do we have problem moving one area or the other? Can we move to the left and right evenly? Can we bend our head to the left and right evenly? And can we move up and down evenly? That's a range of motion test. If there's a lack of motion, it tells us the bones between the spine are not moving properly. If they don't move properly enough, what happens is these bones start to shrink together, so that wash between the bones starts to shrink even more, making this want to compress. When that spine compresses, it can cause pain, nerve pain from the neck, up into the head, down to the shoulder, down the arm, even down the back too. Grab a seat if you want over here. And when we have that nerve pain instead of just neck pain, we want to make sure we look it over for the overall picture. Okay? Perfect. Thank you very much. We talked a second ago how the body works. And you get a visual here. And again, this is my disclosure. I'm not an artist. I'm just a chiropractor, so bear with your criticism of my artistic ability. Okay? So here's a head. Here's a nose. Pull an eye right there for one, too. Our neck in the spine, maybe the neck, mid back, and low back, have a curve. What I mean by that, these bones should line up at an angle and work its way all the way down to form a curve in the spine. When it does it naturally, at that point, that curve allows the bones to bend and shift like a spring, hold that position, and from there, when it holds position, back and forth, then our body can move normally in the range of motion again, left and right, forward, and flexion back and forth. Okay? Any questions about that? We talked about how the body works too. So again, if you have a head here looking from the back, you have, for example, shoulders here, total neck, shoulders, both sides, arms down here, let's go here, then the body here. Okay?
Is it okay if I shut the door so
of course.
we can hear better?
Yep. So someone always knocks if they want to come back in.
Okay.
So we talk about how the neck works. We want to work with these areas here in this spot. So we want to work with the neck. We're going to work here with the neck, along with here. This spot's here and here to make sure this whole body is working together. Okay? As a chiropractor, my job is, yes, look at the neck spine, but also how it affects the head again, how it affects the shoulders, and how it affects the upper back. We talk about that. We talk about, for example, shoulder pain. Shoulder pain can be either pain out here in the shoulder itself, or pain between the shoulder and neck, more the upper chapter. People get confused, and I just tell them, hey, tell me exactly where it is. When it's there, we talk about headaches too. We're going to affect the overall head, causing headaches not only back to the head, but sometimes people get headaches or even behind the eye. That same nerve that controls headaches also controls ear pain, ear pressure. Okay? So we want to look at what the people are feeling overall, talk about neck pain, and also affect upper back pain. Okay? So upper back pain can be anywhere from say, for example, lower neck, here, down to even further down to where here, which I tell the females, we're around the Broadway. So we want the whole picture where the area location is, the problem is first, and we talk about how do we move that area better. In chiropractic, our job is to move the bones, if it's not in this position here, to where sometimes it can be abnormal on an x-ray, so it can be instead more of a straight spine here, or even a spine where it actually bends the other way, here, artistic ability is getting worse and worse. Okay, where it bends the other way. So when someone has this type of a normal spine and neck pain, sometimes it's more muscle tightness, sometimes it's a quick pinch in the neck, sometimes it's from trauma too, correct? Has there ever been a car accident? Anybody? I have several. Okay? Accidents will cause localized acute pain. We want to make sure we get that. Someone come in today from an accident yesterday. We want to get that pain out there as much as we can so these muscles around the body become looser as soon as possible. If someone is not coming in from an accident, it's chronic pain, for one, chronic pain in the neck, we want to make sure we fix that as soon as possible too. One thing, if we need to take an X-ray and see where their body is, see where the vertebral bodies are, the parts of the spine, and make sure these parts of the spine, wherever they are, get it back from here. That's where it is to start, back to better position. Okay, we do that with just adjustments for one, too. We also want to make sure the muscles, if they've gone to this position here, what's going to happen with their spine? They're not going to be here. They're going to be more flexed forward, more hunched forward, more shoulders pulling forward, more of the neck muscles up here, the upper traps, pulling up this way too. So you want to make sure wherever their spine is, how is their structure adapted to make that their normal spine and make that their normal. Let's get it back to a better position. Okay, any questions yet? Any questions? Good? Okay, so our job is once you've done the assessment, you figure out where the location of the problem is, exactly where the neck pain is, and where it's traveling to. Is it causing upper back pain, headaches, or shoulder pain? At that point, how do we now move these muscles around the spine, if needed with the adjustments too, to make the body lean back here? So we get to here structurally, but also here physically and soft tissue-wise. Okay, if we just move the bones every day, which some chiropractors do, if someone's posture is like this, their posture is going to be like this. You're going to have to keep coming back, back, back. The pain never really goes away. Okay? Our job as chiropractors is to treat the whole person's well-being, to make their overall body, soft tissues from the outside of the muscles, along with the structure inside, so these things move to the bones, so they all work together to become better position, better posture. What is optimal position? Again, we talked about this before. I've done this before too. We go against the wall for one. Go against the wall. This is kind of hard to this little shelf right here. Is where we put our heels, hips, shoulders, head against the wall. Hold that position, see how you feel. That feels that position. Your neck muscles are tight, upper back's tight, your lower back's tight. That means your body's being pushed forward. Okay? What do we do all day for the most part? What are we doing right now? We sit a lot. The sitting itself will make our body lean forward. Why is that? The weight of gravity times the weight of your head itself. Your head is not an even weighted bowling ball. Most of the weight of your head is in your facial bones and teeth, pulling your head forward this way. So you got to focus on keeping your head back here. What I mean by that is translating back behind your body, not tilting, to make your body want to feel a better position. And over time, if you don't feel this is normal for you, it becomes your normal. What controls your posture in your brain? What do you think? What part of your brain controls your posture, your position in space, your movement? Anyone remember third grade science? Anybody? It's only a couple years, right?
Cerebellum.
Yeah.
Cerebellum. Boom. Cerebellum. Good thing. From unconscious. Came from unconscious. Okay. Cerebellum, back of your head, controls your center of gravity, your balance, your position, your motion. So if my body is used to this position here, leaning forward, hunched forward, causing neck pain, headache, shoulder pain, upper back pain, at that point we have to change our position in space first, physically, then our body, then our mind, our cerebellum, can actually get that to become our normal position, our default position over time. What does it take to change our body's position over time? What does it take for our brain to change that default? What do you think?
Repetition?
Repetition for how long though? How many days, weeks, months,
Every
years?
day.
Every day for how long?
In 6 weeks?
6 weeks, 8 weeks, sometimes up to 2 to 3 months. Depends on where you are, right? Depends if you're here, if you're here, or if you're here. So can we figure out where you are over time, adjust things over time? So if I'm here, and I go here and start walking this way, am I going to be comfortable or uncomfortable?
Uncomfortable.
Uncomfortable. I want to feel uncomfortable, uneasy, off balance, so my brain can reset itself, because it'll cause it to be under a little bit of stress. You go, hey, why am I under stress? Because I'm changing it. So it may take 4 to 6 weeks, 8 weeks, whatever it's going to be for you. If you move in this uncomfortable position, for your body to actually want to change and stay up there. And that's going to help. Will this help just your neck, or also your low back, hips, legs, everything? When someone stands in a better position, your overall body's being affected, right? Not just your neck and shoulders, your whole body's being affected. So it'll help your back, it'll help your feet. People come in and they're walking like this all day. What's it do to their arches in their feet? Make the arches stretch, causing plantar fasciitis. You make those arches become less stressed by putting weight on your heels when we're standing here, so overall body feels better, is more efficient, and over time changes your brain, your cerebellum, to a better position. Okay? How do we start stretching that overall body, shoulder, and neck, and upper back, to make it looser and better? Okay. So I'm going to show you one here. I'll go from the side so it's easier to see. It's called the upper trap stretch. The upper trap connects from your neck down to your shoulder joint out here to your upper back here in a triangle. I'm just going to draw over everything I've done already. That triangle area, to make that whole area here, back here, and here all stretched together. Okay? When we have poor posture or a tight neck muscle, this muscle, especially the left side or the right side, I'll choose one at a time, become very tight. So it becomes tight, bringing that shoulder up and in, making it tight at the neck, shoulder joint, and also the upper back about T3, T4. When that happens, everything becomes tighter, so this spine compresses together, pushes together, causing that pain sometimes. Okay? So we want to do the start. I'll start this way. Start the left already on that left side. So I'm going to do is bring my right hand behind my left ear. You want to try if you can too at home or here in the room. We also want to, when you bring your hand behind your left ear, right hand behind your left ear. Now turn your head to the left shoulder and let the weight of your arm pull your head down toward your body to feel that stretch. Okay? How does that feel?
Like a stretch.
The stretch, right? And you want to be behind, bring your hand behind your ear and then pull down and let your head turn toward that left shoulder. There you go. Good. Actually, let's go this way. Give me 1 second. We'll go here. And then turn and down here. There we go.
Oh.
There it is. There's the ow.
Yeah.
Good. You want to feel, I'll turn around this way too, so it's from the back. You want to feel a light stretch and a little uncomfortable too, right?
Yeah,
if I'm going to cause a change, I want to feel uncomfortable, not just easy, yeah, it's good. You want to feel uncomfortable. You want to make things want to stretch more than you're used to, change your physiology and change your brain. Okay? You want to hold it at home. A recommendation about 30 seconds or so, and just once. Okay, so you want to switch sides now. Let's switch sides. Left hand behind your right ear. We're going to turn your head to the right shoulder. Let the weight of your arm pull your head down toward your body, pushing your ear up to the sky. Good, good. There you go. Wow, look at this class. You guys are very efficient. Good work, good work. So here again, my turn to the right. What you're going to do is bend your head. Again, I'm going to hold it for how long? About 30 seconds. Look at this. You guys are awake today. Have your second cup of coffee. How's that feel, okay? Can we go further down, or does that feel like it's got it, guys. You know, take it easy, right? So hold that position again. We're making the muscles stretch all the way through that area to make it looser, okay? We always want to start with, if we have neck pain, we always want to start with stretching first and then work on strengthening. Why do you think that is? The muscle's already tight. If I strengthen a tight muscle, we're going to make it even tighter and cause more pressure in there. So always focus on flexibility first and then working on strength. Okay? If I'm going to do that stretch here, and I feel, where am I going to feel pressure? 3 points again. You may feel it in the actual base of the neck here, where the top of the neck meets the actual skull, so the suboccipital area. You may feel it the AC joint. You may feel it through the upper trap muscle, or you may feel it in the upper back area here. Everybody's different. So you want to make sure wherever you feel tight, focus on that position, and that stretching will hold both sides evenly. We're all going to have a tighter and weaker side, right? Our bodies are made perfectly, but also sometimes in balance. My hip is usually tighter. I tore my left shoulder before, so my left shoulder is usually tighter too. So I want to make sure if I'm going to stretch, I stretch enough to where I feel that uncomfortable position. At that point, focus on that. Okay, any questions yet? So again, we talked about shoulder position. We want to make sure our shoulders are going to be, if anything, level with your ear, as much as possible, not coming forward. Okay, does that make sense? There you go. We have one more set coming in. There we go. Find this spot. Here you go. We'll go right here too. Share a spot where we want to go.
Keep me away from her. Keep me away
Oh
from
yeah,
her.
I see the friendship there. I see the friendship. So shoulder position alignment, right? Talk about the head being back over the body, and the shoulder being in line. So you see my shirt here. Is you want to come down to where you feel that shoulder's opening up more, not close this way. What makes the shoulder, what makes the upper body posture hunch forward or muscle structure? It can be your pec minor muscle, pec major coming across, and sometimes your anterior delt coming here. Okay? People talk about feeling the whole air body feeling like this. Sometimes people feel even they're being choked. You want to make sure we open these areas up here, make these muscles open up. And also with that, if these are tight, what's going to happen to the back muscles? They're going to be tighter or weaker in the back. This is tight already. Weaker, right? Balance, right? Tighter here, weaker here. You have to make them looser, then stronger back here, so everything in that area, all the way through, becomes more even, more balanced. If I'm more balanced, then I have a full range of motion to now get stronger here instead of here. Any questions about that? So flexibility, right? How do we use one exercise, keep it very simple, we stretch out this area, stretch the front, the pec minor, pec major, anterior delt, and then get the back even stronger over time by pulling everything backwards. Okay? What I do with my patients, I use a broomstick. There's an nephew from Home Depot about 10 years ago. It can be anything you want to use. Okay? I'm not sponsored here. So I'm going to take this broomstick, I'm going to go as wide as I can, go back as far as I can. And for me, because I do it every day, I'll go back all the way, and then I'll come all the way forward. How many people can do this the first time? Very, very few. It took me 3 days to get over my head. I was very frustrated for 3 days. I was grouchy for 3 days. Okay? But can you start just here, wherever you're comfortable, hold, and then come forward. So I have patients start with coming up, hold for about 5 seconds, and come back down. Once you feel those shoulders here tighten up, at that point, stop your position and come forward. Some people will kind of cheat and do this. This feels easy, doc. I'm like, it is, because you're not doing it right. So one is make sure you do the full arch of the broomstick, all the way back if you can. Hold, hold, hold. And then come back forward. Who wants to try this? Who wants to be a brave soul? Come on over. Let's see, we'll come back next to you. Good. So we'll start here. We'll come forward all the way up. Try that and see. Take your foot a little more. And go wide as you can to start. Make it easy for yourself. And come all the way back. Good. And all the way down. Good. And all the way back forward. Does that feel easy?
Yeah.
Good.
A little bit that's scary because
of the shoulder, right?
Yeah.
That's good. So now try one more time. Now let's go a little bit further in. Just bring your thumb in closer and more narrow and see if you see it. Right up there again. So that goes. Good. Come back forward. You can tell too with the shoulder.
yeah,
it is
the
favored a little
shoulder.
bit.
Yeah, the shoulder.
This is your stretch. Right now, where it is right now, perfect for you. If you feel comfortable coming here with that right shoulder, perfect.
Yeah.
Let's work on this at home to make this looser here, shoulder, but also the neck too, right? Everything.
Yeah.
It's all connected.
That's good.
Good work, good work.
Yeah.
Everybody, good job, good job. Anybody else want to try it? That's good? All right. We'll go to the next one. We'll kind of see the next one. Okay. But can we get this, like I said before, too? Get this where, like with her shoulder. What's your name again? One more time?
Enriqueta.
Enriqueta.
Yeah.
Enriqueta. She did this when her, because she has right shoulder problem. Her shoulder tightened like this, like a little tighter here. It's going to happen. Okay. But I want you to work on trying to keep the shoulders even. Even that's tighter, you hold. So both sides slowly stretch together. Okay? Again, we don't want to do this where we come down and start doing this on one side. Or here, we want to make sure you keep that shoulder or that broomstick even on both sides. Okay? Any questions at all? Mm-hmm.
What about the scoliosis? Good.
So with scoliosis, what happens is, it's not the side view that causes a curve in the spine, it's the front view. If I have scoliosis, I'm going to look like my body's bending to one side, and my shoulders won't stay here. I'm going to come back here to cause an imbalance. So I'm going to have a curve that'll be more from the front view. Say the head's here, eyes, nose, more of the spine like this, coming this way. So it can cause the shoulders to look off balance. So if it hits the broomstick here, I'll look like my body's here, but I'm coming back here. So I'm shifting over to one side. Or I'll come here, look like I'm here. But the problem is with scoliosis, the body not only does it bend, but also rotates also. The rotation, what locks up the spine, can make the spine not want to move. It can cause early arthritis, can cause early nerve pain. The problem is too, when I'm bending to one side, my organs, my lung for example, left and right side, start getting pushed over this way, that way. So that compression on the lungs can feel like you have a collapsed lung. It can cause heart pressure. It can cause other issues in your body, not just mechanically in the muscles and the joints, but also your organs too. If you have scoliosis, my biggest thing with my patients, especially, it's 4 times more likely in teenage girls and boys, is getting the body to go, if my body's like this, here, I'm rotating this way, I'm going to look like I'm hunching forward. I want to get the body back, much you can extension, so at that point I get that we're here instead of being here.
So you still need to do these exercises?
Exactly. You want to work on your body being extension more, because extension, if I'm here and rotated, extension allows the body to come back, take that rotation.
Can it slow that down at all?
Exactly. But you can by focusing on posture and position. So the broomstick stretch will allow your upper back to stretch an extension to stay back here. That's the plan. Especially someone, if it's the best thing to catch it early, before the bones start to mature and harden and calcify, about 21, 22. Even afterwards, you can still focus on getting ligaments to stretch, again, back here as much as you can. All right? Good?
It's kind of scary when I see x-rays of a granddaughter.
I've seen them where teenage girls come in and they even have, not only do they have the scoliosis, but they have back pain. When they have back pain, that point affects them emotionally. It affects everyone emotionally when you're not in pain. Okay? And parents are given 2 options, right? Surgery now or surgery later.
Oh.
I had a patient come in and her mom came with her mom's a OBGYN doctor. Okay? Took her daughter to a pediatrician and said, here's the x-rays, doc, what do you think? We can do surgery now or later. Was there anything between now and surgery? No. She's like, that doesn't sound right to me. I started seeing her about 6, 7 years ago. Her scoliosis is gone, and now her body is back here. It took her time to adjust everything. We were able to move those bones, because she was young enough, she's still a teenager, back to here instead of being bending to one side. But taking her mom, who being in medicine, okay, this doesn't seem right to me. You find a different way to treat this thing before she needs surgery. A lot of it's wait to see until it's bad enough, then you need surgery, then what do? And you're done. Surgery for a teenage girl is like a death sentence.
Wow.
Then they're stuck that way. Oh. Any other questions? Yes?
So what initiates scoliosis? I mean, outside of obvious trauma or something?
Trauma and also hereditary too. Sometimes, and very rare, the bones will actually not form properly on one side to make the body shift this way or this way.
What about the addition of CP?
What's CP?
Cerebral palsy.
That's a different monster. Because you're talking about nerve damage.
But if they have both now.
So at that point, when you have cerebral palsy with scoliosis, the nerves aren't firing enough on one side, it's causing the pull. So it can be both medical, scoliosis, or structural too, hereditary, where your body has formed to one side because of things haven't grown properly, or mechanically you've had an injury also. I had a kid come in, she had shoulder surgery, because of that her whole body had shifted over to one side, and now she had mechanical scoliosis from the surgery. So wherever it is, can you catch it early enough to fix the structure So it grows this way and stays this way over time. But the different reason, where you want to make sure you catch it early, that's the biggest thing. The earlier you catch it, you're easier to fix. But if you catch it, harder to fix. Sometimes you come in with, for example, a normal curve of the spine that's fixable, 10, 15 degrees, maybe like this. I had someone come with a 45-degree curve, their body's already way over. And my honest is, hey, I can help you, help your child, but it's going to be a lot of work and you may not get 100%. So early the parents understand, hey, look, different perspectives, see what's going on, take care of it early, that's the biggest thing. Okay? So back to the neck stuff and the shoulder stuff. After the broomstick stretch, what I have patients do is work on shoulder range of motion. Okay? The shoulders again is out here. Get this shoulder to come from here back to here. Okay? How to do that, we talked about a second ago. Make this front pec minor, pec major muscle anchored up, stretched out. Make it more flexible. Make the back stronger. Just work on back strength. I use water bottles at my office. Who likes to drink water? Everybody should. Okay? Using water bottles allows your body, and you can't just keep at home. Whatever you want to use, keep it very simple. I have people go into the wall, take the water bottles, and just go straight back. When I'm doing this, I'll do one at a time. When I'm doing this, I'm allowing gravity to push my hand down along the water bottle to activate the back muscles, to rotate everything backwards. It's better position. So again, I want to start being straight up here, right? Always start here, hands here. And once I'm here, all I'm going to do is have them come down, hold for a second, and then come all the way back up. Okay? So I'm going to do both at the same time. Easier against the wall too, for the wall to hit that wall. Come back, hold, and come back down. Okay? What you want to do though, good. What you want to do is make sure your elbows stay straight, and then just rotate your arms back over the elbows. Perfect, better. By doing that, then these back shoulders work better. So you're going to work back here. Also, when I'm doing this too, I'm going to come back. These muscles across my shoulders are working too, hold me back more instead of being pushed forward. Okay, any questions about that?
Does this help your rotary cuff?
Yes. Okay, so let me show you real quick. Come on over. Grab the seat, grab the seat. Let's use that. You said more on the right side, correct? Good, so here, hold that straight up. And bring that elbow up here. Higher, higher, higher. Now bring that hand down. Is that okay? Oh, you're the base. And then come all the way up. There we go. Then bring that arm down again. We'll let the elbow move, with the elbow right there. And then come back. How does that feel?
Okay.
Where do you feel that?
Right here.
Perfect. You're feeling it back here, posterior delt, upper trap, and even some of the bicep, tricep tendon too. Can you hear everything stronger? Switch sides. Go ahead. All the way down. Good. And all the way back up. How does that feel on this side?
Not bad.
Good. Same muscles, but I would do it on this side, both sides, 5 times. Start. Okay? When you come back here to further, contract back here. Make sure we're working back here, not just the front, not just the outside. Switch sides again. And again, right here, come all the way down. And come back and contract the muscle in your lower neck too, not just your shoulder. Does that feel okay? Good. Perfect. All right. Magic. Good. So stay right there for me. Put both in there now. Let's do them together. Good. Come all the way down. Right there, bring this a little lower if you can. And now come up together. Go back as far as you can. Back, 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 back. Hold, hold, hold. 1, 2, 3, 4, 5. And come back down. Good. I like the 5 holding. Do you feel differently with 2 water bottles? Do you feel different? More pressure back here? Perfect. Good. It's allowed by 2 water bottles to hold back, to work together, to push together. Not just the top, but also the bottom too. Good. Perfect. Good job, good job. All right. Good work, good work. Maybe golf class, maybe golf class. that encourage people, right? Okay. Another one is this one here. I want to also work part of it, a bit a second ago, with the 2 water bottles. I want to come up here, and when we're doing this together, 2 water bottles allows the whole back to contract across the shoulders here. So here allows you to pull in instead of just pulling here. Okay? Now we want to work almost the whole back together. Here, the whole rhomboid, it's called the rhomboids. It connects from the shoulder blade, bottom shoulder blade, to top of the shoulder blade, the whole thing on both sides. What we're going to do as a standing fly exercise, we come here, hold 2 water bottles, bend over about maybe 5 degrees, and come straight up, hold for a second, and then come straight down. The goal with this is to make that shoulder blade go together, right? The whole thing's going to come up, we're going to come up, we're going to hold for a second, and come back down. So we want all this contractors, what we want to do is make sure we pinch here, and also pinch here down below, to make sure everything again comes up, hold, and come back down. Any questions about that? So I'd like that one you can, I'd rather use this standing than sitting. You get more motion, you're able to balance yourself easier with your feet. If you're sitting, it's hard to balance your overall body. You want to maintain that position again. You want to have your thumbs pointing out. You want to have I want people to do, make sure the water bottle aligns with your head the whole time. So we're here, aligning with your head, hold, and come back down. Want to try it? Want to try it? I know, I saw the eyes. Let's see. So here, and then here. There we go. And then come up, here. Good. What I want to do is bring go down one time. Come down and then come up. Out here. There we go. Here. There it is. Want to go wider. Good. Head up, head up. And down. And then wide again. Out here. There we go. Pinch here and pinch here. There we go. Hard to do, right? It's not easy.
Yeah, it's too many things to remember.
Good. Come on down. And one more time.
I can feel it in the back of my shoulders.
Perfect. Burn. Feel the burn, baby. There we go. Good. Perfect. All right. Go and rest up. Go and rest. Take a break. I'll give you one of the water balls afterwards. Good work. Good work. Who else want to try it? Anybody else? All right. This is what I want to focus on, is getting all of this back here in my back area, making it strong. So if I'm strong, what happens is I'm pulling myself back this way instead of being stuck this way. Does it make sense? You want to add the muscle exercising so the joints actually want to feel the compression and readjust, come back before the cerebellum, so our body stays here instead of here. Any questions there?
Does that weight have anything to do with when you do that?
You want enough weight where you feel that resistance. And over time, as you're comfortable with that, then increase the weight. Always increase the weight. When you increase weight, that means your body is better, right? The problem is, a lot of us are scared of doing weight because they think it's going to hurt us or cause injury. But that's the best way to know your body's better. We don't know until we stress our body, are we good or not? I don't release patients from care, especially in an accident, until they tell them they're back to working out and they're back to doing weights. Back to adding the weights they did before. So I want to make sure the body can have that load not only physically, the muscle structure, the muscles, but also your spine can handle it too. I want to know their body is better. If I can handle weights, and I can handle sitting in a chair, working 4, 5, 6 hours at a time, and here instead of here. When I do weights, what are we doing? When we do weights, what are we doing? We're building muscle strength, right? We're also building muscle endurance. The muscle endurance allows us to sit for hours at a time and not feel we're doing this the whole time. So we want to add the muscle strength so the endurance kicks in, so your body stays here instead of here. Okay? Next one is the biggest problem. What's the biggest problem you think the last couple of years of causing neck and shoulder pain, upper back pain? What's the biggest, I guess, cause? Sitting. Okay? So when we sit, what causes the pain? Because we sit like this. We don't start this way, but we end up this way. How do we adjust our posture? We've done this 1,000 times already. Adjust our posture to better position so we're here over time instead of here. When I'm doing this, is my shoulders shifting, my neck shifting only, or is my whole body shifting back here, right? My lower back is getting higher up, causing more of an arch in my back. My overall body is coming up here, my shoulder's coming backwards. I do this with like exactly. We bring our feet underneath us this way, allow our hips to stay above our knees, go toward the front of the chair so our body's here instead of being here. Exactly, perfect. Allows our hips to open up, allows our back to really stretch and extend out, allows your lower back to become more an extension, allows the muscles in your lower back to work to hold your body up here instead of our body having to hold up by leaning back too far. Having your feet on your toes, for example, knees below your hips, allows your body now to shift the weight on your hips instead of on your tailbone. Okay, so here again, I'll switch sides. Same thing. Here, knees below our hips. If you can, up on your toes, you're bouncing on your hip bones, not on your tailbone. So we're here on your muscles to work to hold us up, not becoming weak and leaning too far forward. Okay, when we lean too far forward in bad sitting posture, the shoulders roll forward, the shoulders come up. So why do the shoulders come up? Because we're trying to keep our head further back. We're also working to hold our head back instead of it being back naturally here, more of a balanced position. Okay? Any questions about that? So once we're here and we're in this better position and can hold as much as we can, then the exercise we talked about before allows you to have the endurance to stay back here. Not feel tired, exhausted, having headache, shoulder pain, upper back pain. Even problems where we'll have finger pain too, or finger numbness also. Okay? Last exercise, then I get back to work. This is J-O-B, I got to pay all my taxes, right? It's California. Here, another one. I want to work on, now we talked about some of the stretches for 1, 2, those exercises to do reverse fly, and also these two. Let's put it all together. I want to work on this muscle here now, the upper trap muscle, make it stronger by causing that muscles from here to here to work. Okay? I want to make it work, but I don't want to make it work here. I want to make sure our body's leaning back more. So I'll take, again, 2 water bottles, same one my sponsorship, Cedar Brothers. I'll put my hands out 90 degrees to my shoulders, but I want to make sure I'm back and make sure with my hands I rotate them out. Why do I do that? Rotate my hands out so my thumbs are pointing forward to make sure these muscles back here are coming out here instead of rotating forward. Okay? So I'm going to force that by doing a shoulder press, my thumbs pointing forward, my palms pointing out. I'm going to come straight up, hold, I'm going to come straight down, only to my shoulder level, and hold right there. I'm going to do a little bit of an arch, coming all the way up, hold, and coming back down. Good job, team, good job. Okay? And with your hands, again, hands, with your thumbs pointing forward. There we go, good. Good, 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 good. All the way up, hold, and all the way down. As much as you can, if you can go back, if we can get our bodies, as much as you can, get the elbows to go horizontal with the body with this one too, same thing. That point allows your shoulder to really work just in the back portion, not the front. Okay? All the way up again, and all the way down. Any questions about that?
Well, that thing about putting your thumb forward.
Putting your thumbs forward,
It's
palms
hard.
out.
It's hard.
It is hard.
Unless you're not holding the ball.
Exactly, yeah. If you have bots, it'll be easier sometimes.
I would think.
But it's gonna feel, if it feels awkward, tight, or uncomfortable, fantastic. It means you gotta work on it. You know by saying it.
How many times should you do
I like 5 times to start, 5 to start. And again, the goal of this is not the bounce. You want to do is come up, hold, come back down as 1. Hold for a second, then come back up, hold, come back down as 2. Okay? That's the goal. Okay? Last one for the shoulders to the last one, the very last one. I'll give you my bonus one today. Is the shrug exercise. Okay, again, we talked about the shoulders here. I mean, everything's strong, so we're strong when we lean back more here instead of leaning forward. So this one, the shrug, same thing we want to do is have our hands now. We want to have our palms up and forward, facing forward, and coming straight up and coming straight down. It's not a roll. It's more of a straight up, hold, and coming straight down. One vector again, straight up, very small motion, hold, and coming back down. And making sure the head What you can is coming back behind your shoulders first. Here, come all the way up, hands pointing forward, and all the way down. Again, 5 times because to start over time, we have to about 10. And these are all going to help your body again, loosen up first, move to a position posture, and then strength to help the endurance to sit and not feel like you're feeling tight, sore, comfortable in the neck, upper back, or shoulder. All right. Any questions at all? Questions?
You just have to do it.
Just got it done. I had someone come in today, I'd seen him for about a year, and he's very physically fit. I asked him, what's your secret, Robert? I go, I exercise every day. I walk half an hour a day, then do 15,000 steps, but he walks half an hour a day. But he does, has a stretch routine every day, and has a strength routine every day. Anywhere from 5 to 10 push-ups a day, very simple. But walking and stretching every day. Every day. You can find whatever works for you, a routine to start stretching, working on posture, working on some maybe 1 exercise a day for strength, have a routine going. It'll take you 2-3 weeks to get into your routine. It won't feel easy, it won't feel comfortable. Good. Let's make it comfortable because it makes your routine over time. But find whatever works for you to get that routine going Monday through Sunday, every day that ends with a Y, allows your body to feel that difference, the result of your body changing to here as your normal instead of here as your normal. All right? Any questions at all? Kind of give you all the upper body, shoulder stuff to start. January, we have a talk every month. At that point, come back. I don't know what next month is. But let's work on more things over time and pick one thing from the exercise we talked about today. Again, this video will be on YouTube, your YouTube channel. I'll give you a card if you want it. At that point later today, probably later today, like tomorrow morning, at that point you'll have it there to watch it again and again and again. All right? Questions?
One question.
Yes.
My neck is like the middle one.
This one here, right?
Yeah. It's straight because of a car accident.
Mm-hmm.
So, I was been thinking that neck straight is causing me a shoulder issue.
Mm-hmm. So how do you get the whole body back here more? Work on this first and see how things feel. If things don't feel good, then you may want to see a chiropractor.
Okay.
I know a decent one too if you want to refer.
Okay.
Just saying, you get the idea.
Yeah.
But work on everything first. And I tell people, yeah, see me, but make sure you're doing your homework too.
Yeah.
Without that, your body's going to keep going back and forth. This takes work, right? I'm going to put some cards there if you want to look at my cards. Information, you have all your sign-ups right here too. At that point, I'll see you guys next month.
I have a comment.
Yes, sir.
One of the things that's going back and thinking in my mind,
Yeah.
in the military,
Mhm.
they teach you to walk straight,
Mhm.
and straight down, in other words. And right now, when you're going through all that kind of rough, I'm average of doing that. And I've always done about an average of, not always, but most of the time, 10 minutes of exercise right after I get out there. And that gets me going.
The best time of the day. Why we get out of bed? In the morning, I have my coffee. I'm high tech. I have my coffee maker already made by the time I get out of bed. I don't know. I understand how technology works. That when the timer works. But I get out of bed, do all my stretches and my routine. By the time I walk my dog, I already done 15 minutes of stretches. I'm done. But wait till at nighttime later on. The phone's going off. My wife wants something. The dog wants to go for a walk. I get it done early. What's out of the way? I sometimes do a workout with some people, friends of mine. 5:30 in the morning. Boom, done. We're home before the sun comes up. But it's done. Wait till the end of the day, you're like, oh, I got too busy with this. I'm too tired from this. Get out of the way. At that point, when you exercise in the morning, how do you feel? Blood in your head. You feel more clear. You feel like everything is moving right. You're already warmed up for the day. Then the stress of your day becomes easier versus you wake up, you're like, ugh. You can handle your day versus letting it bypass all of a sudden, I'll do it tomorrow, tomorrow. So make sure you get it done, whatever it is for you routine-wise. My wife's a night owl. She goes up at night. By 9 o'clock, I'm in bed already. But whatever works for your schedule, whatever works for your body, get it done every day so over time you see the results. Military is huge for that. And posture here, right, stretching here, where your body feels more efficient. Why do we have good posture? Prevents injury. If I'm in the military, you're going to run for what, 10 miles a day? At that point, you want less injury because you're here you're going to cause more injury. More feet problems, more leg problems, more back problems. That position is huge for anybody, especially on the load. I had a kid come in probably about 15 years ago. went right service after high school, Army. He was 130 pounds, 50-pound backpack every day, 10-mile hikes. He was beat up. His neck was beat up. But his body was here the whole time. The load was too much for him, but his body learned to be here instead of high school, we're here. It's training. All right. Anything else? Yes, ma'am.
Can I have you say something about plantar fasciitis?
Yep.
I missed last
Good.
month.
So plantar fasciitis is basically the plantar fasciitis, just to review, comes from here, your arch from your midfoot, down to your heel. Okay? That is controlled by a ligament that comes from your calf muscle, and it's the ligament that goes around the ankle up to the forefoot. So you want to make sure everything here is stretched out, because that controls how tight the arch is. So what people do, take something solid, put their foot on the back of a chair, let it stretch all the way. And keep your knee flexed the whole time, knee locked out so it's only the calf stretching, not the hamstring. If you bend your knee a little bit, it becomes more of a hamstring stretch. What you want to do is have that knee locked out, all the way down to where you're comfortable, hold for about 15-20 seconds, relax 3 to 4 times. But with posture 2, with standing, you want to make sure you're standing on your heels when you're standing and walking, not on your toes. On your toes, what will happen is then the arch becomes overly stretched, causing more pain. You also want to have a shoe that does not flex. Okay, so I want to make sure if I'm going to buy a shoe or walk with shoes, I want to make sure my shoe in the middle of the shoe does not bend. I can't bend it. We're not teenagers anymore, right? Keep this arch supported by having that inside of your shoe, that middle part of your shoe, being as sturdy as possible. I wear inserts in my shoe inserts, even for more support. You know, definitely you want whatever you can to help your feet stay better, helps your whole body get better. All right, any questions about that?
It lasts a long time when you have trouble with it.
So make sure your shoes are solid. I tore my arch about 7 years ago now, doing triathlons and marathons. It took about 3 years to heal completely. Now, it does take a while, but doing it every day, and you want to heal over time. But good shoes is the key.